Hello, I'm Dr. Eric Guy. I'm a board certified internal medicine doctor, and I've been treating diabetes for many years and obesity for many years, and would like to talk about the prevalence of obesity and diabetes. And I'm not going to get into the treatment, that's a whole new topic, but hopefully this will help you understand diabetes. Um, so, to start off, I'd like to say that the prevalence of obesity prior to 1980 was 15%, and that was 15% for many years. Okay, and something happened around 1980 that has caused the obesity epidemic to rise gradually and inexorably until now it's 35%, which is a 20% increase in the prevalence of obesity um, over 40 years. And there's many thoughts as to what that has been, but I believe it's because of highly processed foods with high fructose corn syrup, and that has been a huge problem because number one, it's addictive. Number two, it's real cheap. So, and number three, the food industry and television has been really marketing this, and that has been leaving a strong impression in our minds to eat this kind of food, and fast food taken off since then. Now there's a big epidemic of obesity and with the consequences of diabetes. So anyway, I hope you can see how I feel about that. And so the prevalence is now 35%, and that's millions of people, millions walking around with that. All right. So what are the complications of obesity? Number one complication, as you can predict, is diabetes. Diabetes has many consequences, which start heart disease, kidney disease are the biggies, with increased risk of heart attack, infections in your body, having ulcerations in your skin, possibly end-stage renal disease, and need to be on hemodialysis. So it's a big thing that needs to be treated well and prevented if possible and cured if possible. And that's something we can really talk about later. What other complications of obesity besides diabetes would be high blood pressure, and that itself can cause end-stage renal disease. High blood pressure is this dubbed the silent killer. So that needs to be taken care of. As well as many other problems such as non-alcoholic steatohepatitis or NASH, which can lead into cryptogenic cirrhosis. And then you have obstructive sleep apnea, as well as myriad of other psychiatric problems, anxiety, depression, low self-esteem. A lot of more problems than that, okay? Sexual problems. So anyway, that's another topic in itself. So let's talk about the CDC information. You can see there's a report called the National Diabetes Statistics Report, and it was chronicling all the statistics in diabetes since 2004, the year 2018. And it turns out that the percentage of people with diagnosed diabetes is 10.5%. Okay. Undiagnosed diabetes as of 2018 was 2.8%. Together, that is 13.3% with undiagnosed diabetes or diabetes. Now, that may not seem like a lot to you, but that's like 35 million people. That's a lot. Okay. It's like what, 3 New York City population? Anyway, it's really a lot. Now, I don't really want to scare you too much, but you got to know I am talking about the prevalence of diabetes. So there's something called prediabetes, and that is by definition hemoglobin A1C of 5.7 to 6.4. You have prediabetes, and that can lead into diabetes. It turns out that 34.5% of the U.S. population, or 88 million people, have prediabetes. Now, I don't even want to tell you how many people are undiagnosed with prediabetes. That's a lot more. So if you put the 13% with 34.5%. Then the total for prediabetes, undiagnosed diabetes, and diabetes is 47.5%, which is almost 1 in 2 people, which is really hard to believe. And so that's higher than the prevalence of obesity, 35%. So you might be saying, well, how can that be that the prevalence of obesity being 35% and diabetes and the complications of prediabetes, diabetes almost 47.5%? How is that possible? Well, because a lot of people are overweight, which is BMI of 25 and above. So 70%, just remember 70% of people are overweight. It's a huge number. All right. So the statistics on diabetes and treatment, it turns out that 77.8% of patients with diabetes are being treated by a provider, which is a nurse practitioner, PA, or a doctor, which is actually pretty good. I think that's good, 77.8. The number of people achieving the guideline of 150 minutes of leisure time exercise is not so good. That's 24.2% based on this. And so 1 in 4 people almost are exercising by the guidelines. So let's try to exercise more. Patients report that 77% of the patients report that they are controlling their weight or they're losing weight. The use of statin therapy is 58.4% from the ages of 40 to 75. Basically, if you have diabetes, you're going to be on statin therapy. It's a recommendation because if you have diabetes, your chance of having your first heart attack is equivalent to somebody who doesn't have diabetes, who had their first heart attack, having their second heart attack. So it's like a diagnosis of coronary artery disease. But something can be done about this, okay? Don't give up. I mean, just you got to work hard to get that down. And so you basically need to be on statin. Now, there's a few people who are intolerant to statins, or believe it or not, maybe their cholesterol is good because their sugar is really well controlled, or from any other reason. Not everybody's on statin therapy, but pretty much everybody should be if you have diabetes. We look at something called the ABCs in diabetes. A is for hemoglobin A1C being less than 7, the blood pressure being less than 140/90, C for cholesterol being less than 135, the non-HDL cholesterol, and non-smoking is the S, the ABCs. And for that group, the chance of that happening, okay, all the criteria in that group being met is 19.2%. So most people are not being adequately treated for diabetes, okay? So number one, diabetes is a huge problem, okay? And there's many people who are overweight, and that's exactly linked to the obesity. I got to tell you that you're looking at a person right now who actually had diabetes, and I was on 3 medications for diabetes, and I got on the ball and I've lost a lot of weight, and I want to share with you how to do that because I was cured. Last time I checked, my hemoglobin A1C was actually 5.7. Now that's the very beginning of prediabetes, but next time I check it, it's going to be better because I'm going to lose my weight. So I'd like to help you lose weight, and if you have diabetes, I know how to help you to get this thing taken care of. Okay, don't give up, don't lose hope. You can be treated for this. Now, there's a book I'd like you to read. This is it right here. It's an excellent book, and it'll really help you when it comes to the diet. And there's a gentleman, he's a doctor, he was a nephrologist. His name is Jason Fung. You can look him up on YouTube, but he gives really good advice. And if you follow his guidance, I think you won't go astray. So I hope this was helpful, and hope to give you another video. And if you have any questions, let me know, and I'll be happy to answer them. Have a good day. Bye-bye.